Questions for our panel, please.
Yeah, for Mr. Vice President, and then a question for Dr. Birx as well.
Sure.
On the ventilator issue, with 8,400 of them in the stockpile and tens of thousands more coming, why are states like California and Washington needing to send ventilators to other states, and is that smart if they might need them later on?
Well, I'm going to let Dr. Birx speak about what's happening in California and Washington, because it is a real credit to the people of both states and the leadership of both states to see the progress that we've made. We continue to witness that the numbers where the outbreak began, we all remember when this first emerged in the Seattle area, the numbers continue to be steady and low. And what we've seen the governor of California do, what we saw the governor of Washington State do, and the governor of Oregon, where the coronavirus hasn't arrived to a large extent in Oregon, I think is in keeping with the highest tradition of the American spirit. I mean, they are understanding what I think Americans are understanding more and more, that while we tend to think of this as one large curve in our minds when it began in our country, and we long for the day that it will end, and we want to hasten that day by putting into practice all these mitigation efforts. The reality is, what these experts have explained to this layperson, is that what we're actually going to witness is a number of small curves that will cumulatively mean that curve. And for Oregon, for Washington State, for California to recognize where the need is, and then to partner with us and FEMA to make sure the resources are there at the time of the need, at the point of the need, I think is really inspiring. But Dr. Birx, do you want to speak to that?
Yeah, I want to be clear. No, we didn't ask for their ventilators. They looked at their epidemiologic curves. These states have amazing health commissioners, and I think when this is over, we'll really be. All of the models were based on something we have never attempted to do anywhere in the world. We have never attempted to do this kind of mitigation. It was always theoretic to many individuals. And now we see across the globe people mitigating against this virus, realizing that their own behaviors can change the course and future of this virus in their communities, which is really astounding, the power that gives us to actually understand that we can compete against this virus and do well. And so I think their governors and their health commissioners looked at their curves, looked at their hospitals, looked at their ICU, and looked at their needs, and then decided that they didn't need those at this time and wanted to make it available for other states that were in more of that 2 per 1,000, 3 per 1,000, 4 per 1,000, and 7 per 1,000. And I think we'll learn a lot from other states and other communities to really understand how to do this better next time. And I think this is what will teach us, because we've never attempted anything like this, at least in my lifetime, where we've had, these 30 days to stop the spread. I mean, we've not ever put out information like that. So I think you heard the CDC director talk earlier today about, in the models, how different individuals thought communities would mitigate and the rate at which they would mitigate. And I think you can see that across the world, we're learning that when you give communities the information that they need to understand what's going on, and you're transparent, that communities can be part of the solution in a transparent and amazing way. And I think this kind of education and dialogue is always critical when you want communities. I think when I first started here 5 weeks ago, I said that we will win based on what the communities are able to do as a community of Americans. And I think we're all really deeply impressed about what they were able to do. So it was the governors who decided.
The testing backlog, I just had a quick follow-up question on that. How close are we to getting into that 24-hour window you've talked about being very important? And then what is the status of the self-swab test?
So we're tracking all of that very closely. I use my time here to appeal to people specifically, the health educators, the health advocates, because I know the power with them. But to my lab directors, I really need the Abbott M2000 online, because that means we can do an extra 100,000 tests a day. And there's enormous power in that. the ability to self-test, last time I had my test here, I self-tested, so it can be done. It's straightforward. It works very well with that rapid 5-minute test. But what we now have to create, and I know that's always difficult because everybody wants one of something, we now have to create a mosaic that brings together where we know every single machine is in the United States, where our gaps are, and then align resources with need and gaps in the testing and ensure that we have the right laboratory test for the right community. So you can see there would be communities, particularly the Indian Health Service or rural communities, where that Abbott ID Now kit could be incredibly helpful, because otherwise they're shipping it all the way to a capital, maybe 3 states away, and that's going to add 2 or 3 days to the wait time, which we're trying to get away from.
Is that where we're at in the backlog, 2 or 3 days, or what would you?
It varies state by state, and we'll be talking with all of the states about really changing how we do testing in the community to really ensure that we're testing optimally. Because right now we have still focused very much on hospital diagnosis because we know it will make a difference in treatment. So these major laboratories are still putting drive-through tests at the back to all the hospital tests. And so that's where the backlog is in the drive-through tests. So I know if you're an outpatient, not an inpatient, but if you're an outpatient, that is where the delays right now are, but it's state by state. And so some states have 24-hour, 48 hours for both their outpatients and inpatients. Others have short for inpatient and longer in outpatient, and then we're trying to reconcile those two pieces.
Right. And the team is actually meeting tonight to review that, but one of the data points that we review is literally on a state-by-state basis what the turnaround time is for testing, and we continue to work that. And these Abbott laboratory devices there's 18,000 of them across the country. When you go to your doctor office and get a strep test, it's that device. All Abbott Laboratories has done with strong and swift efforts of the FDA is create a test to put in that for the coronavirus, and it's a 15-minute test. And so I want to renew our call to all the healthcare providers around the country is find your Abbott device, and we'll work our hearts out to get a test to you. How about in the back corner?
Mr. Vice President, thank you. One for you and then one for either of the doctors, if you don't mind. For you, sir, back to this idea of reopening up the economy, since it's not like there's a switch that you can just turn it back on. How does the administration envision this happening? Is it guidance from the White House and you hope the governors follow it? Or are you going to put it in the governor's hands or the mayor's hands? How do you envision all of that working together?
Well, the one thing I can assure you is that the president's decision in that regard is going to be informed by what the data shows and about decisions about when we can responsibly reopen America and put America back to work. I can tell you the CDC will have new guidance tomorrow that the CDC will be publishing for people who were in proximity to an individual that tested positive for coronavirus but have no symptoms. And CDC will be publishing new guidance about how those individuals and the circumstances under which they might be able to return back to work using some facial protection and monitoring their temperature, but we'll detail that for you. But what we're going to be doing over the weeks ahead is, while we focus every day at the point of the need, as the president said many times, our first mission is to save lives. And that means to slow the spread, to bend the curve, to continue to engage the American people, which they are admirably doing, to continue to put all the social distancing into practice. But there is a dual track that the president has already initiated. Some of the best minds here at the White House are beginning to think about what recommendations will look like that we give to businesses, that we give to states, but it'll all, I promise you, be informed on putting the health and well-being of the American people first. Dr. Birx?
Either for Dr. Birx or for Dr. Fauci. Or do either of you want to take that? Or?
Go ahead.
Secondly, as a lot of parents are sitting home with their kids, and they've been home with their kids for weeks now, and they're wondering, maybe resigned to the fact that maybe their kids aren't going back to school this year but are looking ahead, what do you think summer camp holds, and what do you think the start of next school year holds? If you could look down the line, do you think those start on time? Do you think school next year starts on time?
Can I say a word on behalf of teachers since I'm married to one?
There you go.
My wife was all day yesterday at the elementary school she teaches at, loading up about 500 bins of art supplies for kids. And she's just one of millions of teachers across this country who find themselves having to distance teach kids. And I'm proud of Karen, but relatedly, I'm proud of every teacher in this country. Secretary of Education was here not long ago talking about our efforts to expand distance learning resources, even in K through 12. To all the teachers who are out there, we just want to say thank you. Thank you for what you're doing, for continuing learning even in this challenging time. And to all of the kids, just because you're home doesn't mean you don't have to do your schoolwork. Keep it up.
Anticipate children being back in classes in August and September?
What I will tell you is I'll yield to the health experts, but that'll be part of what we're looking at in terms of guidance going forward, whether it be summer school or whether it be returning to school next fall. But the most important thing we can do is put this epidemic behind us as quickly as possible.
Well, my daughter is a school teacher, so she asked me the same question. You know, it is unpredictable, but you can get a feel for if we start talking about the things where the curve goes down and we really have minimal, how we respond and what kind of a rebound we see or don't see, I think is going to have a lot of influence, probably more immediately on things like summer camps than it does in the fall. I fully expect, though I'm humble enough to know that I can't accurately predict, that by the time we get to the fall, that we will have this under control enough that it certainly will not be the way it is now, where people are shutting schools. My optimistic side tells me that we'll be able to renew to a certain extent, but it's going to be different. Remember now, because this is not going to disappear. So we're going to have in place the capability of doing the things that we talk about all the time on this stage, to identify, to isolate, to contact trace, number one. Number two, by that time, we'll have a better feel with the antibody test about what the actual penetrance of this infection was in society. How many people have actually been infected? Who's protected? If you have antibody, it's very likely that you're protected. Who's vulnerable? Do you treat vulnerables different than you treat the people who are protected? All of these things are going to go into the decision of just how much back to the original way we would like it to be in the fall. Bottom line is no absolute prediction, but I think we're going to be in good shape.
Dr. Fauci? I just want for Dr. Fauci or Dr. Birx. Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality. And I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections? And and things like that.
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
No, I think there's so much focus now on coronavirus that, particularly if you take New York, which we all know is having a disproportionately higher proportion of the burden of the entire country is right now in New York. You know, I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.
How about one more?
A question for Dr. Fauci on the virus hitting Black communities the hardest. I mean, these numbers are staggering. Louisiana and other states are reporting 40 to 70% of deaths are African Americans. Do you expect that pattern to continue nationwide? Some states have not even reported their data yet.
Yeah. You know, I can't be confident to predict patterns, but the underlying reason why that is happening doesn't change from state to state.
So you expect it to get worse?
Now, I expect that when African Americans get infected, given the disproportionate disparity of the underlying conditions that lead to complications like the ones I mentioned, I expect that we will still see the pattern that when you look at the proportion of people who get into serious trouble and die, again, it's going to be disproportionate towards the African Americans. I do expect that.
And is the federal government now leading the charge in collecting this information from the states, and when will it be made public?
Yes, the answer is yes. It will be public as soon as you get enough data to be able to make a meaningful statement.
So can we expect this week or a couple of days?
The task force has assigned that to several members of the team. We're assembling that data now. It is a great concern for us, and but it's probably a good reminder that we have to be especially careful around people with serious underlying health conditions. As we've said it many times from this podium over many weeks, that the risk of serious illness from the coronavirus remains low for the average American. But for anyone from any community that has a serious underlying health condition, particularly senior citizens with serious underlying health conditions, the risk of tragedy is very real. And so we're going to be very diligent about studying this and providing information and guidance in accordance with our best scientists. But I do want to say to each and every American, the President's coronavirus guidelines for America about wash your hands. If you're sick, stay home. If you can work from home, if you're not in critical infrastructure like our incredible healthcare workers or all those heroic people working to keep food on the shelves at our grocery stores and keep medicine at the pharmacies, we ask you to work from home if you can. Avoid unnecessary travel. Avoid gatherings of more than 10 people. Use a drive-through at a restaurant. Don't go in the restaurant. Not just to protect your health, but to protect those of every community, of every background in this country who may have underlying conditions that make them susceptible to tragic outcomes. That's how we can all do our part to slow the spread and to protect our most vulnerable. And the American people are doing it, and as we continue to do that, we will hasten the day that we put the coronavirus in the past and we reopen America and put America back to work. Thank you all. We'll see you tomorrow.